Hello everyone, welcome to ManpreetRN Talks. So, if you are struggling with the nursing exam questions like NORCET, NCLEX, or CBT, don't worry, you are at the right place. So, here we are practicing smart questions, learn fast, and move one step closer to your passing NCLEX, NORCET, or CBT exam. So, liver biopsy, in which a needle is inserted through the abdominal wall to the liver to obtain a tissue sample for biopsy and for the microscopic examination. So now the nursing responsibilities that is very important for exam. So in the exam question are basically asked about the position. So during what position you provide to the patient and after liver biopsy, which position should be provided to the patient. So you have to remember those two positions. So pre-procedure. So before taking the biopsy, what should the nurse do? So always witness informed consent should be obtained and always withhold food and fluid at least 8 to 12 hours before the procedure and perform a baseline assessment including vital signs of the patient and assess the result of coagulation tests like prothrombin time, partial prothrombin time and platelet counts and always obtain blood typing and cross mass because liver biopsy, it is a highly vascular procedure. So during procedure, a needle is inserted in the liver. So it may lead to internal bleed. So there is a risk of bleeding. So must check if the patient can clot properly. That's why it's important to obtain a coagulation test before the liver biopsy. And teach the client about post-procedure care and explain that they need to hold breath after expiration when the needle is inserted. So if sedation is prescribed, then you should administer to the patient. And now the position that is very important. So during liver biopsy, so patient should be placed on the left lateral position or supine with the right arm above the head because it exposes the right side of the upper abdomen. So liver is on the right side. So to expose right side of the upper abdomen, so patient should be placed on the left lateral position during procedure. Now we are going to talk about post procedure. So post procedure, what is very important? Assess patient vital signs and assess the biopsy site for bleeding and monitor the patient for peritonitis as I have discussed in the previous video, sign and symptoms of peritonitis. And very important, place the client on the right side with a pillow under the costal margin for at least 2 hours after the procedure to reduce the risk of bleeding. So, and always instruct the client to avoid cuffing and straining because it can lead to increase the intra-abdominal pressure, so that can lead to risk of bleeding. And maintain bed rest for at least 12 to 14 hours after the procedure. And very important, always instruct the client to avoid heavy lifting and strenuous activity, exercise at least for 1 week, and to avoid cuffing and straining, as I have discussed previous, because it may cause increased intra-abdominal pressure and notify the healthcare provider immediately if you are experiencing dyspnea, means difficulty in breathing, cyanosis, and restlessness. So, because these are the signs of pneumothorax, because during liver biopsy may have injury to the lungs. So, for example, the nurse is preparing a client for a liver biopsy. During the review of client's laboratory result, the nurse notes that the client's prothrombin time, that is 35 seconds, and platelet count is 1 lakh. So, based on these findings, what would the nurse do? So, the client's prothrombin time is prolonged and the platelet count that is also low. So client is at the risk of bleeding. So that's why the nurse should must immediately notify the healthcare provider of these findings. So patient may have risk of bleeding and client should be put on bleeding precautions. So that's all about liver biopsy. You should remember that important things, positions, prothrombin time, platelet counts for this biopsy. So thank you very much.